he said he was going to dim the lights. So, Wendy is up here. Wendy.
Good afternoon, everyone. We'd like to welcome family, friends, faculty, and staff, and most of all, our White Coat recipients who have come today to participate in the White Coat ceremony for the College of Health Professions at Rosalind Franklin University of Medicine and Science. For those of you who are not familiar with the history or meaning of this type of ceremony, I would like to make a short statement on its meaning and the history in healthcare and its specific meaning here in the College of Health Professions. The White Coat ceremony had its inception in 1993 in medical schools, and since then has become a national and international phenomenon. I know I'm dating myself when I say this, but 45 years ago, I was sitting in an audience similar to yours, receiving my white cap as a nurse, and it had very important meaning, and I'm very happy to see this type of ceremony coming back to use. The intended goal of the ceremony was to encourage and endorse professional development and humanism in medicine. When the decision was made that the College of Health Professions would have its first White Coat ceremony in 2005, some special ideals from the spirit of our college were added to those already stated. Our Dean, Dr. Carlson, will elaborate on, and discuss some of the implications of the meaning of the White Coat in his address in just a few minutes. The faculty of the College of Health Professions at Rosalind Franklin University wishes to acknowledge your accomplishments that you have made thus far in your programs and professions as you come to the conclusion of your first year of academic studies. Most importantly, we wish to impress upon you the importance of the next stage of your education, where you will begin or enhance your clinical skills and experiences, where you will develop the skills to become patient-centered caregivers who understand interprofessionalism and can operationalize it in the clinical setting. For those of you who have already begun your clinical experiences, it is a reminder of the obligation that you have to your patients and to further develop your skills. Whether you provide direct patient care at a bedside or in a clinic, or you are in a profession that has less direct patient contact, you might be looking at a slide or a specimen, it is still your commitment to the special practitioner-patient bond that is the ultimate culmination of scientific knowledge and technical abilities combined with the humanistic values that I just talked about. We wish to profess those values through this public ceremony as you continue your professional development. At this time, I would like to introduce Dr. Jim Carlson, our Dean of the College of Health Professions, who has some inspirational words for us on this important day.
Thank you, Dr. Salloway. First, also, I would like to welcome our students, faculty, and staff. I'd also like to extend a very warm welcome to the families, friends, and supporters that have traveled to celebrate on this occasion with us, and a very warm welcome to those of you who could not be here today but are joining us through a live web stream. First time we've done this, and I think it's great to be able to reach out to families who couldn't be here with us today. I won't talk for long, as the focus today is on our students. I just want to spend a few moments to talk about the white coat and most specifically what it symbolizes to our professions. And more specifically, what it symbolizes to you and the patients that you will be serving. Prior to the late 1800s, physicians wore black. This is from the Gross Clinic, which is a rather famous painting by Thomas Eakins. And the reason they wore black, this is a serious profession, right? And tuxedos are serious, right? We wear them to formal occasions. Clergy wore black, right? To signify the gravity of the relationship with their parishioners, and so did physicians. Okay? Over the past 100 years, though, significant scientific advances have been made. At this time, right, when you were wearing black and seeing this, it didn't quite have the aura of hygiene that we've had, for example, the past 100 years with advances of science. For example, this may not be the best place to have a surgery with several people watching in a non-sterile environment. So black maybe was appropriate because you were more likely maybe not to even, well, maybe do worse for seeing a physician or seeing a practitioner than better at that time. But the past 100 years has brought us a lot of advancement in the sciences that have truly made us, put us in a position to improve patient outcomes. So the dress of the clinician has evolved, right? The white coat that you're going to be donning today, all right, and putting that on, along with the professional dress that goes along with what we expect from you in the clinic and what your patients likely expect. So this is really a symbol of a rite of passage, of your readiness to move into the next phase of education. Specifically, it's a phase marked with increased responsibility for patient care. So I'd like to spend a few minutes more deeply considering what the white coat you're about to be given represents. For us, your faculty, right, this represents transition. It's a way for us to formally say you have acquired the knowledge and skill to accept the responsibility for patient care. You've taken the tests, many of them, all right, demonstrated progress, and you have earned the privilege to begin your clinical journey. We're proud to see you transition to that. This is no easy task, and I commend you on that achievement. For your family, friends, and supporters, can I get a shout out to the family, friends, and supporters who are here? To the students, you did not get here alone, right? To the families and supporters who are here, I'm sure you're filled with pride. I'm sure this white coat represents the pride that you have in your student. Okay? Perhaps you're reminded of the sacrifices you made with your time, your finances, or the sleepless nights worrying about that son or daughter many time zones away. Personally, I want to thank you for giving your son or daughter the character and moral compass that they will bring to their profession. They did not get that from any test we gave them, and they did not get that from any book we had them read. They got that from you. So today, as your loved one walks across the stage and is given their coat, think about what that means to you. And if you are inclined, tell your student, your son or daughter, right, what it means to you. This is the beginning of the next step of their path. But they will, I am sure, continue to need to hear your wisdom and guidance as they follow that journey. To my students, okay? So what does the white coat mean to you? Excitement? Maybe as our guys on the left here, please don't let me mess that up, right? Fear, anticipation. I hope you've thought about it, though. And if you have not, take a few moments during the ceremony to consider what the white coat really means to you. Toward the end of this ceremony today, you will take the Hippocratic Oath. It is an oath you should not take lightly. It is an oath that defines the gravity of the responsibility that comes with wearing this coat. And I urge you to take that responsibility very seriously and take that oath very seriously, because your patients will. So what does this symbolize for your patients? To my patient, and as their students, I'd like you to finish this phrase. Just finish it in your head. To my patient, the white coat represents, and you fill in the blank. Okay? You should be keenly aware, okay, that your coat will generate meaning and emotion for the patients you serve. For some patients, this may generate fear. Many of you have learned about white coat hypertension. Okay? For those of you that don't know, this is an understanding that we talk about, that sometimes you have a patient that comes into your office and you take a blood pressure and their blood pressure is very high, but that doesn't mean they necessarily have high blood pressure. They're just nervous to see you, right? So this is good to know because it lets us make an accurate diagnosis, not an inaccurate diagnosis of high blood pressure. But to our students, I would ask you, think about this. Why is this here, right? What's the anxiety that they bring with them? Look for that. So understand that when they see your white coat, they may see all the knowledge that you have to bring and they see you, but they may bring their own anxiety with it. Be aware of that, address it, be comfortable with working with them on that. For others, the coat may symbolize hope. The hope that feeling less pain than they are in, a hope that you hold a secret that can alleviate their condition. You may not always see it, but all the testing and rigor that we have put you through this past year will help you bring that hope to your patients. That is why we do it. So, top of the picture here you see our white coat. At the bottom you see a clinician here in a white coat, and then a robot. Okay? I show you this because this is the future of telehealth, and it's here, right? It's been happening for quite some time. What do I mean by that? Many of you will be practicing not just with your patients in front of you, but from patients maybe thousands of miles away. This robot is used to go from room to room in hospitals, for example, where an expert can actually tap in and see them from a control room somewhere along the way. But they're still communicating with their patient, they're still listening to their patient's concerns. My point in showing you this is that while the white coat means something for you today, it may mean something different for you tomorrow and as you gain more experience. Technology will change. Policies are swirling right now around you that will change the way you will deliver care from a stance of policy. But do not change the way, the foundation that we've taught you in how to take care of patients with regards to your integrity. Okay? You can choose how you would like to practice. So address that meaning now. What does the coat mean to you? And hold on to that. In a few weeks, the pockets of your coat will be filled with notes, devices, cheat sheets, and everything you need to get you through the day. Over a few months, your coat will start to get lighter. You'll rely less on those cheat sheets and those devices to some extent. It will show other wear and tear. It will show maybe rips, pen marks, and other things from you going about your busy days. As you approach this next phase of training, then I offer you two final pieces of advice, and this is from experience with patients. Trust the training we have given you. It will carry you far. Trust yourself. At this point, we all remember what it was like to be just entering your clinical year. Trust yourself. We've given you a lot to trust. You've earned it. And most importantly, from time to time, please, please launder your white lab coat. Thank you.
Thank you so much, Dr. Carlson. Those inspirational words were also very thought-provoking, and I'm thinking those white coats are a few pounds heavier than when you brought them in here, thinking about the responsibility that you will take on as you wear them every day in your clinical training. At this time, we'll present the white coats. The chair of each department will be presenting the coat, and the names will be read by a clinical director from the program. For the Department of Physical Therapy, Dr. Roberta Henderson, Chair, will be presenting the coats, and Dr. Patrick Withrow will be reading the names.
Catherine Beda. Ryan Breen. Ryan Carroll. Quinn de la Concepcion. Aaron DeMarco. Vincent DeViro. Alicia Dorco. Austin Eichelberger. Mallory Epping. Margaret Everly. Catherine Foster. Brendan Frank. Alicia Fredrickson. Brett Fulca. Skylar Gebhard. Courtney Graber. Charles Grant. Kayla Hogger. Shelby Heilman. Nathan Hilsey. Lauren Hooks. Ann Cumming. Matthew Lawler. Amber Lissaway. Vanessa Lowe. Yong Mai. Kate Marconi. Nicholas Martin. Claire Matsky. Troy McGilligan. Mary Montgomery. Jonathan Opperman. Sharon Rapace. Travis Robertson. Aaron Rusinski. Elizabeth Ryan. Aaron Schanneberger. Jacob Schick. Emily Schwecke. Sean Seiler. Rena Shaw. Callan Shandley. Kaylee Springer. Derek Stables. Kelly Stevens. Joshua Stevenson. Ruben Torres. Jamie Yoon. Congratulations.
For the Pathologist Assistant Program, Dr. John Vitale will be presenting the coats, and Professor Mary Dido will be reading the names.
Wigmas Abagaz. Enver Asani. Anton Baltuska. Shira Barnett. Kia Buchanan. Britton Kavanaugh. Sydney Cooley. Brianne Cyrus. Kathleen Schmutt. Megan Dembski. Spencer Dries. Amy Fairchild. Marissa Catherine Feldman. Amanda Fulmer. Sarah Garner. Jared Giambi. Catherine Hoffman. Michelle Paul Lee. Chia Lee. Jeffrey Levin. Ashley McLaughlin. Kelly Miles. Carla Munoz Alba. Aaliyah Neubauer. Rachel Pettit. Erica Price. Jenny Kwok. Brooke Robertson. Samantha Saunders. Cassandra Schmutz. Megan Shepard. Catherine Stoik. Lindsay Tobias. Jennifer Viana. Congratulations.
I'm going to answer a question that some of you might be asking yourselves right now. Why the different coats? The professions match their coats to the ones that are most useful in the clinical setting. So you'll see a couple of variations in terms of the coats. For the physician assistant program, Professor Michael Statler will be presenting the coats, and Professor Jeff Green will be reading the names.
Kelly Anderson. Corinne Offman. Ashley Eit. Rebecca Breda. Kristen Brezovar. Allison Bull. Justine Burns. Jatame Carden. Garrett Carlson. Vicky Chain. Allison Chevrier. Grace Daniels. Alexandra DeWolf. Samantha Doty. Megan Dwyer. Kelsey Ferrend. Chloe Farrar. Kayla Geishan. Gretchen Greenwell. Ryan Guilfoyle. Eliza Harold. Ted Hegner. Molly Janda. Allison Carmen. Alicia Kemenu. Carrie Kenkel. Stephen Cluck. Jessica Kozlowski. Courtney Kramer. Melissa LaJeunesse. Tara Lassala. Andrew Lee. Stacy Lewis. Kathleen Lurch. Tanya Lohmeyer. Tracy Markle. Matthew Martinek. Catherine Matheson. Catherine McAllister. Haley Miller. Joe Miller. Congratulations. Good job. Kelly Mon. Congratulations, brother. Good job. Mary Catherine Mott. Sean Pollock. Good job. Congratulations. Amanda Peterson. All right. Congratulations. Good job. Good job. Andrew Prelitz. Congratulations. Jolynn Reed. Caitlin Schlorf. Jill Seeger. Kelly Smith. Congratulations. Good job. Kelsey Smith. Congratulations. Good job. Marcy Spalsbury. Congratulations. Good job. Luke Stockdale. Congratulations. Rachel Sugnet. Good job, Luke. Congratulations, bro. Good job. Diana Tam. Wendy Tan. Irina Demosevskaya. Congratulations. Good job. Jennifer Trace. Congratulations. Good job. Andrew Trace. I'm sorry, Andrew Tran. Lauren Troutline. Aaron Wanish. Congratulations. Aaron Ward. Hannah Wheaton. Congratulations. Good job. Man Ching Ye. Ashley Yusum. And Jessica Zarzecki.
Thank you. For our programs in psychology, our Doctor of Philosophy students will be followed by the Master of Science in Clinical Counseling students. The coats will be presented by Dr. John Calamari, and Dr. Kenneth Kessler will be reading the names. I think they're not here.
Got it. John Anderson. Laura Aylward. Allison Brown. Catherine Derbyshire. Lauren Drandorf. And Zachary Rush. The following students are in the clinical counseling program. Aisha Azimuddin. Keith Britton. Lindsay Bugno. Anne Carreño. Luciano Gomez. Martin Preet. Courtney Stenerson. Christopher Williams. And Ken Zidek.
Thank you. At this time, I would like to invite our white coat recipients to rise, and Dr. Dimashki will lead us in the recitation of the Hippocratic Oath. I would like to invite any clinicians in the audience who would like to renew their oath to rise and join us.
Again, new White Coat recipients, I want you to, just like Dr. Carlson said, to kind of reflect and think about these words as we recite this. So let's recite the Oath of Hippocrates. We'll do that all together. At the time of being admitted as a member of this healthcare profession, I solemnly pledge myself in service of humanity. I will give to my teachers the respect and gratitude which theirs are due. I will practice my profession with the conscience and dignity. The health of my patient will be the first consideration. I will respect the secrets which are confided in me. I will maintain by all the means in my power the honor and noble traditions of this. My colleagues will be my brothers and sisters. I will not permit consideration of religion, nationality, race, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life, even under threat. I will not use my knowledge contrary to the knowledge of humanity. I make these promises solemnly, freely, and upon my honor.
Thank you, Dr. Damashki. After the ceremony, I would like to invite everyone to join us in the lobby upstairs for some refreshments, and the Centennial Room up on the second floor is open. Please feel free to take your family on a tour of our lovely facilities. Now, this is my favorite part of the ceremony. If I could ask the White Coat recipients to turn around and face your family members so they can see the beautiful sight that I see, and give them a hand. Thank you. That concludes our White Coat ceremony for 2015.
It's awesome.
How about it?